Hello, my name is Elizabeth Sangiorgi, and I am currently a genetic counseling student at MGH Institute of Health Professions in Boston. And today I'm going to be presenting on the article Hemangioblastoma and Mosaic von Hippel-Lindau disease, rare presentation and review of the literature. Before we dive into the summary of this paper, I would like to provide some definitions of words used throughout the article, starting with Mosaicism. All humans have genetic information that helps our bodies develop and function. Half of our genetic information is inherited from sperm, and the other half is inherited from egg. In other words, half of our genetic information is inherited from each of our parents. A copy of this genetic information is stored inside every cell in our body, and typically every cell in our body has the same copy of this information. However, mosaicism is when some cells in our body have different versions of this genetic information. This image on the right shows how mosaicism happens. A genetic change can either be inherited from the sperm or the egg, or it can happen randomly during pregnancy. As the cells divide and grow, we see that some cells have one copy of genetic information, which is the purple cells, and other cells have a slightly different copy of this genetic information, the blue cells. The blue cells can be present in different numbers throughout the body. For example, the skin may only consist of 1% of cells with the genetic change, while the heart may contain 4% of cells with the genetic change. The second word I'm going to go over is germline. Germline refers to genetic changes that are present from conception and can be inherited from generation to generation. Germline genetic testing typically uses blood, saliva, or a cheek swab to look for any genetic changes that could be passed down. Whereas somatic refers to genetic changes that occur in our body after we are born and are not typically inherited. Somatic genetic testing uses a specific tissue sample, so for example, a tumor sample or a skin sample, to look for genetic changes that may be different from the rest of our body. Somatic testing is a great way to look for mosaicism because it can give us insight into genetic differences between different tissue and cell types throughout our body. So, in this article, they present a case of an 11-year-old girl who was diagnosed with one hemangioblastoma. Due to concern for VHL, germline genetic testing was ordered and came back negative. 5 years later, an MRI showed a small lesion, and it was recommended she receive consistent follow-up to monitor the lesion's growth. And 4 years after that, another lesion grew and required surgery. The pathology report confirmed that this lesion was another hemangioblastoma. Repeat germline testing was ordered, in addition to somatic testing of 2 different hemangioblastomas. The germline genetic testing came back negative, and the somatic testing came back positive, which gave her a diagnosis of mosaic VHL. This article concludes by recommending that providers order additional somatic testing of tumors when VHL is suspected, but also notes that there are no clear guidelines for surveillance in patients with mosaic VHL currently. Additionally, it is unknown whether children of people with mosaic VHL will inherit these changes. So people with mosaic VHL should potentially consider testing their children for VHL as well. And that was it. Thank you so much. I hope this was helpful. I hope you have a nice rest of your day.